Community Health Partnership of Illinois creates access to quality primary care services for the uninsured and the underserved.
And their mission is simple. No one is denied services based on their inability to pay. Drs. Elise Sawyers and Thomas Gavigan join us with more on their mission and their upcoming fundraiser. Thank you both for joining us. And what incredible work you're doing. So can you talk about that? What kind of organization Community Health Partnership of Illinois is?
Thank you so very much for having us this afternoon. Again, my name is Elise Sawyers. I'm with Community Health Partnership of Illinois. We serve the uninsured and the underserved. We operate from 7 different locations, including our corporate office here in Chicago. We provide services, medical, dental, and behavioral health services, over 30,000 visits in any one given year. Patients can access our care regardless of the ability to pay. We operate on what we call a sliding fee scale. We are funded by the federal government, and so no one gets turned away from care.
What's remarkable is that it says 99% of patients live in low-income households. So does this mean a lot of these people may not get care if not for you and what you're doing?
Yeah, this organization is able to take care of patients that are really disadvantaged and don't have access to care. The first group is the agricultural workers that come to work in the fields for the growing season. Then they go back to their country. They're in a small town. They don't know anyone. They don't speak the language. They're here briefly. And we provide them access to care. Plus, the people in the towns, the small towns where the clinics are, also have access to care through the clinics. So we're able to take care of multiple groups of people.
And that was so important, especially during the pandemic and as COVID continues to be an issue, right?
Absolutely,
Yeah.
That's correct.
And can you tell us about, you said 7 locations. Can you list off some of them?
So we operate and have health centers in 7 different counties: Peoria, Kane, McHenry, Champaign, Kankakee. Again, our corporate location is here in Cook County. But we have patients that come from over 39 counties just accessing care, even across states, including Wisconsin, Texas, as well as Idaho. So our centers are open to all. And again, we try to offer not just primary preventive, but other social determinants of health we try to address. Food insecurities, housing. We partner up with community partners that are better able to serve our population with other needs.
And you're helping even by providing transportation, linguists, anybody who can help provide these services. And of course, this all costs money. So one of your big annual events is coming up here, the Harvest Fest. Can you tell us a little bit about that?
Sure. So in order to supplement some of the things that we do, in addition to the federal funding that we receive to provide or make sure access to care is available to our patient population, we have to also find other ways to fundraise, to supplement, support, provide, create access for other social determinants of health. Like we talk about food insecurity. We have partners that assist us with that. So our fundraiser started 3 years ago. It's the Harvest Fest. Our foundation is built on serving migrant seasonal agricultural farm workers. Dr. Gavigan spoke to over 8,000 farm workers we've served in any one given year. With the pandemic, the numbers declined, but we're on the rise in terms of access to care for farm workers again. We don't only serve farm workers. Our centers are open to all, so anyone can come in for care. Our providers are the accreditations, certifications are not different from the hospitals, so on and so forth. So our fundraiser was put in place to add to a program that we have currently called the Voucher Program. It's a historic program, but from that voucher program, the money fund raised, we also help our patients to seek tertiary, specialty, diagnostic care, and so we supplement and offset some of the costs of care outside of primary preventive for the patient population.
An incredible holistic approach. And I love that this year's theme for Harvest Fest will be the Great Gatsby.
Absolutely.
Sounds like a great time.
So wonderful. Dr. Elise, Dr. Thomas, thank you so much for being here. The Community Health Partnership of Illinois' annual Harvest Fest Masquerade Ball is October 19th. For tickets and more information, you can head to chpofil.org. All the information right there on your screen.